this continues to be the best place for you to receive accurate, fact-based information about the coronavirus in the state of Rhode Island. And I have found throughout fighting this crisis at every step of the way, the best way to combat the panic, the anxiety, and the frenzy is with facts. So tune in here. I hope that it gives you a bit of relief and an opportunity to take a breath by getting the information from the folks who are on the front lines for Rhode Island fighting the coronavirus. Unfortunately, I need to begin today's press conference on a sober note by reporting our first 2 deaths here in the state of Rhode Island on account of coronavirus. Obviously, the potential for the loss of life has loomed over us for weeks from the very beginning. These are the first 2 deaths and will certainly not be the last 2. We take all of them seriously. Our hearts and thoughts and prayers go out to the families, and know that we're with you, and all of the entire system and all healthcare providers are doing everything that we can in order to keep Rhode Islanders safe. I will say that this is, for me and for all of us, a reminder of the stakes that we face. I have been saying for weeks that deaths are inevitable. Today are the first 2. There will be more to come. Our hospitals are, today we're up to 29 hospitalizations. And in the weeks to come, we are going to be climbing up the curve. At exactly what rate, we do not yet know. But I don't want folks to be surprised when we start to see that happening. This is exactly what we've been predicting and planning for and working for weeks. Today I'm announcing we have 36 new cases in the state of Rhode Island for a total of 239 cases and 29 people in the hospital. We have been at this as a community for about a month. For about a month, I have been asking you to radically change your lives. And I know everyone's getting restless. We're all tired of being cooped up. And as the days drag on, it's getting more and more difficult. My approach has been to attack this virus aggressively, trying to stay a step ahead of it, but also in a targeted and thoughtful way. That has been the approach that will continue to be my approach, to take a smart, targeted approach based on facts, based on data, and based on science. To everyone who is heeding our directions, I'd like to say thank you. I know how hard it is. It's hard on all of us. It's difficult not to go to church. It's difficult not to visit your loved ones in a hospital or assisted living or in a nursing home. It's difficult to educate your children at home. It's extremely difficult to shut your business down and go without a paycheck. And to all of you who are heeding our directions, I want to say thank you. I want you to know you're doing the right thing. You're protecting yourselves, and you are quite literally saving lives. To the many of you who are not following our directions, I need you to do better. We need you to do better. I get data every day. The state police, town managers, mayors, public safety, police are out there every day filtering back information to me around how well Rhode Islanders are doing complying with the new regulations related to social distancing. And right now, our best estimate, albeit imperfect, is that we have maybe 50% compliance. Yesterday, if you had gone to the seawall at Narragansett Beach, you would have seen crowds of people crowded together in total violation of the social distancing guidelines that I've provided. If you drive around to big box retailers, you will see crowds of people too close together in line, too many people there crowded together in grocery stores, in big box retailers, in small retailers, on main streets. If you had been in parks and in beaches all over the state, you would have seen far more than 10 people congregating together in close proximity. If you had driven around last night, you would have seen far too many house parties of more than 10 people. I said it last week, I'm going to say it again. Knock it off. You are risking the lives of everyone in this state. Today I've reported 2 deaths, and in the days and weeks to come, there will be many more. We know we're on the way up the curve. We're working every day to refine our model to figure out exactly where we are on that curve, exactly how many additional hospital beds and ventilators we're going to have to procure in order to keep Rhode Islanders alive. We don't exactly know now. We don't know because it depends on you, the people of Rhode Island, and your willingness and ability to cooperate with these directions. Right now, we are not ready for a surge. I wish we were. It's not for lack of effort, but it's proving to be very difficult to compete with every other state and 129 countries around the world for the hospital beds and ventilators and PPE that we need to ready our system for a surge. Were it to happen in the next week or 2, we would not be ready. That means I need every single Rhode Islander cooperating with the orders that I am giving to keep us safe and to keep us healthy. And to those of you who are doing it, I know it ain't easy, and I'm grateful. And to the other half of you who still aren't complying, it's time to get serious, it's time to get real, because this is going to get very real very fast for all of us. And if you do comply, if you do what we're asking, we're going to stay right where we are, a step ahead of the virus, and one step closer to me being able to reopen this economy, which is the place that I want to get us as fast as safely possible. Because we're seeing such noncompliance with the orders that we've been issuing, I have just signed an executive order to further clamp down on some of these restrictions, and I am issuing a stay-at-home order for all people in Rhode Island. The order will be in place from right now until April 13th. What does it mean? It basically means if you're not getting food, getting medicine, getting gas, going to work, you need to be staying home. It's pretty simple. You can go for a walk, you can go to the park, you can go outside. If you do it with a few people and there's ample social distance between you and the folks that you're with. If you are sick at all in any way, if you have the sniffles, you have to stay at home, period. We don't have ubiquitous testing yet in the state of Rhode Island. It is my goal and intention to be testing 1,000 people a day by sometime next week, and we are on path to hit that goal. We are not there yet. That means we don't actually know precisely how many people are in the community that have coronavirus. We do know we're in a phase of rapid spread, and we have 29 people in the hospital. What that means is we're very focused on symptoms. We're at a place where we're very focused on hospitalizations and symptoms. We're quarantining and focusing based on symptoms. When we get to a place where we have more testing, we'll be more accurate. That means right now, if you have any symptoms of any kind, you are ordered to stay at home. And if you need a hand getting groceries or getting out, let us know, and we will help you do that. Or call your town manager, or call the mayor, go on the Department of Health website. We're ramping up those services by the hour to be able to help you meet your needs. In addition to the stay-at-home order, I'm also issuing the following orders effective immediately. All gatherings of more than 5 people are banned. This means everywhere. This means outside as well as inside. This means around your kitchen table, as well as around your conference table at work, as well as any place you can think of. If you're in close proximity to more than 4 other people at any one time, you're doing something wrong. I realize many of you still have to go to work. We are still having to go to work. To our healthcare providers, thank you. You are truly on the front lines, and I appreciate it. For the rest of us, you should be working from home. If you have to go into the office, you should do it. You should be there as limited time as possible. Keep at least 6 feet between you and other people, and at all times avoid gatherings of more than 5 people. Another note on this. Try to limit your interaction to the same 5 people. It's not that you should be with a different 5 people every day. Again, we're doing our best to contain this as much as possible while we ready our system, our healthcare system, for the inevitable surge which will come. So if you have to be with people, make sure it's the same people each day, not a different 5 people every day, so that you're not spreading it to, not multiplying your number of contacts. This is about limiting the number of human contacts that each one of us has every day over the next few weeks. Domestic travel. Starting immediately, any person coming to Rhode Island by any mode of transportation after visiting any other state in the country for any non-work related purpose is directed to self-quarantine for 14 days. This restriction will not apply to public health, public safety, or healthcare workers. Yesterday, I announced fairly extreme guidance in an executive order as it related to folks coming from New York. I want to thank you all. I want to thank the State Police and the National Guard for enforcing that. It's a necessary step. To that end, I've been hearing from many folks, particularly in coastal towns, about an influx of out-of-towners into our rental properties. So I'm announcing further action. I'm directing realtors and hotel operators to include in their rental and purchase agreements new requirements that any out-of-state renters must quarantine for 14 days in accordance with the guidance that I'm delivering. I want to take a second to thank the realtors and the Realtors Association and also Airbnb. You guys have been great. We've worked with them through the night to come up with this. I think it's a great solution. It's a way to allow people to continue to rent their properties, but to do it safely and to help us impose the quarantine. So thank you. I'd like to make a special note to commuters. I know we have a lot of commuters in Rhode Island who work in Massachusetts. As I've said many, many times, if you're able to work from home, you must work from home. I know that doesn't apply to everybody, but it does apply to many people. So if you can work from home, you must work from home. If you live in Rhode Island and work in Massachusetts at a job where you can't work from home, then you can go to work. You have to go to work. But when you come home to Rhode Island, you're self-quarantined. If you're a doctor, a nurse, a social worker, a therapist, public safety, have to go to work, I understand that. Go to Massachusetts, come home, and self-quarantine in your house. This is consistent with the direction from Governor Baker a couple of days ago, asking all people who travel to Massachusetts to self-quarantine. The next announcement is one that I have been trying to avoid, but in light of all the facts and circumstances, I feel it is necessary. Starting Monday, I am ordering all non-critical retail businesses to close their businesses until April 13th. There'll be a complete listing later today on the website of the Department of Business Regulations as to what defines a non-essential retailer. This is a step that I take reluctantly after great consideration, and it's a tough one, because I'm trying to maintain a semblance of an economy for as long as possible while we get through this. Having said that, we're receiving too many reports of people crowded into gift shops, retail shops, shops on Main Street, malls, outdoor malls. So for now, as of Monday, I'm ordering all non-essential retail closed until April 13th. And I'm asking everyone in Rhode Island, if you can, if you have the money to keep shopping, please keep shopping local, and just do it online. Go online, buy something today from a local retailer, help them out if you can. For the small retailers who don't have a website, who don't know how to take orders online, please reach out to us and let us help. You can call 521-HELP. We have secured a lot of resources from local tech companies, from Microsoft, and we'll help you get a website up and running. We'll help you get your e-commerce website up and running. We'll help you figure out different technology so you can adopt your small business. And again, due to the stimulus package, you're all now eligible for unemployment insurance. Previously, you weren't, but now that Congress has passed the stimulus package, independent contractors, small business owners are all eligible for unemployment insurance. And it is my sincere hope and desire to keep this limited until April 13th. And as I said at the beginning, my ability to do that will depend on everyone's willingness to follow these directions. I want to make another note. That order is limited to non-essential retail. It is consistent with my overall approach. Maintain a semblance of an economy, be smart, and be targeted. You'll notice I haven't said anything about manufacturing or other industries. That's because I want you to keep running as long as you can, as long as you do it safely. I want as many people working as possible, as long as you can do it safely. And when we do get to the business of reopening our economy, which is something I think about every minute of every day, because I know this is very, very difficult, it's going to be incrementally according to new rules that are designed to keep everyone safe. As we've gone out and about, and I am checking in on this every day, and we're doing spot checks on manufacturers, spot checks on child care centers, spot checks on retailers, spot checks on lawyers and doctors and accountants, we're looking for compliance. And if you're in compliance with the social distancing requirements, we're going to let you stay open. But if we start to see lots of folks congregating, sick people at work who shouldn't be there, then I will have no other choice but to further clamp down on this economy, which is not something I want to do. We're getting a lot of questions about parks and beaches. At this point, I am not closing the parks and beaches. We are ramping up our enforcement. DEM will have additional folks out there today monitoring the beaches, monitoring the parks. State police is out every day. Local police are out every day, first responders. So if in a few days it looks like we still have large congregations at parks and beaches, then I'll have to close them. But right now, it's still an outlet for people to get outside, to have some exercise, to be with their family. So I'm going to keep them open, but I am imploring you, please, that if you're out, which is a great thing, because you need exercise and fresh air, and it's good for your mental health, please do it in small groups and with the same group of people who you're used to being with. Yesterday, a reporter asked me if I'm worried about the optics of what I'm doing. Today, it's Saturday, we've been fighting this for a month. I have ordered the state police to monitor our border and stop cars coming in with New York State license plates, order them into quarantine, and collect their contact information. I've deployed the National Guard to TF Green, every bus stop, the bus terminal, every train station, taking people's contact information and ordering them into quarantine. You drive around, the economy is essentially shut down. And the answer is, of course, I'm worried about that. But I am more worried about and focused on outcomes than I am on optics. That's what this is about, outcomes, not optics. Right now, we are very, very fortunate to only have 29 people in the hospital. We've been at it for a month. We are not New York. We are not New Orleans. We are not Chicago. We could get there, but we are not there. Because we've been smart, we've been aggressive, and you guys have been terrific, and everyone pitching in to make this happen. And after asking you to do hard things for a month, I'm back here today asking you to do even more. It's necessary. When you ask me if I'm worried about the optics of the National Guard knocking on doors today in Westerly and in Newport to figure out who's from New York and taking down their number and enforcing a quarantine, I don't like those optics. I'm more worried about the outcome of our hospitals being overrun, running out of beds, running out of ventilators, running out of PPE before we're ready for a surge. I have no good options in front of me. I'm out of good options. I'm out of easy decisions. I choose between bad option A and bad option B. So here's what I am doing. Making every decision based on facts, evidence, and data, listening to experts, being flexible and changing, operating incrementally. I didn't shut everything down all at once. And listening to you, hearing from the people of Rhode Island. It is my goal and intention to keep our economy on pause while we ready the system, and then over time to have a more pinpointed approach to how we enforce social distancing. Unfortunately, right now, our testing is such that we're not there yet, so I'm having to take a more blunt approach, shutting down all non-essential retail, shutting down whole parts of our economy. Sometime, I hope soon, weeks, not months, we'll get to the business of reopening our economy, relaxing some of these conditions, and having them be much more pinpointed. That's the goal, that's the plan, that's where we're going. We've made a huge amount of progress in the past week to get our system there. Right now, that's not an option. So to those of you who are saying it's too heavy-handed and the optics aren't good, I hear you. It's the best option we have right now to keep Rhode Islanders safe and healthy and alive, and frankly, it's the best option and decision in order to get us back on track and open this economy more quickly.